Hi there! How are you today? I'm Jenny and welcome back to my channel. Today I'm here to bring you the long anticipated birth plan video thing. If you have been wondering, as you watched my bump dates, getting into my 30s and progressing along to the last month of my pregnancy, you may have been wondering if I've been thinking about labor and delivery. Yes, well I have. And so I figured it was time to bring you my birth plan. And so I've got it all written out in a nice little, column-y sort of situation here. And so we're just going to talk about that for a little bit today. And I'll try to make this kind of quick. It hopefully won't go that long, but we'll see. There's kind of a lot of stuff to talk about when it comes to the plan that you have in place for your birth. There's so many things to consider, and it can be a little bit overwhelming. So if you're one of those people who was like, birth, don't know what's gonna happen and I'm nervous, and I feel you. So anyway, if you've watched my vlogs up to this point, you'll probably know that I am planning on having a natural birth. And as just a disclaimer for this video, of course, this plan is for my ideal type birth situation. I totally understand that things do not always go as planned, and I am prepared to improvise and to act in whatever manner at the time seems to be the best choice for me and my baby to ensure a safe and happy delivery for everyone. So just to put that out there in case you were like, oh, she's crazy, that'll never happen. I'm aware that things can go awry, and I'm prepared to deal with them. So if you were wondering why I chose natural childbirth, that's kind of a whole big thing. I'm not a judgy person as for whatever type of childbirth you would like to have, epidural, C-section, whatever. But the reasons that I chose natural childbirth, well, one, I just sort of always knew that I would have natural births, if possible. It just never even crossed my mind to not have birth naturally, or to go in there requesting drugs or requesting a C-section right away. Maybe it's just the anthropologist in me, but I just feel like I'm a part of a long evolutionary chain of events that have led to me being given this body, and it has an amazing ability, and it has an ability to function throughout this process extremely efficiently to bring the baby that I have been gestating for 9 months into the world peacefully and happily, and I don't see any reason to mess with that process, if you get my drift. I have told some people that in my life that I'm doing it naturally, not my immediate family, but other people, and I've gotten that reaction of, oh my God, you're crazy. Why would you do that? And I just feel like that is so backwards. Not to judge anyone else's decision, but birth is a natural process. People all around the world give birth naturally every single day, and we have for the last 200,000 years since we evolved. So what is the big friggin' deal with wanting to do it in the 21st century is what I ask you. It's just also part of the American psyche at the moment. There's a narrative in this country that birth has to be painful and that we have to be strapped down to beds on our backs and screaming throughout the entire process. And that is not true. So if you are believing those stories being fed to you through ER and the TV series, you don't listen to them, okay? Anyway, I'm a part of the whole birthing without fear type of thing, Ina Gaskin, all of that crunchy stuff, so look into it if you want. But just know this, if you're one of those people who hears natural birth and thinks, oh, that's so dangerous, no, it's not dangerous. Any woman who gives birth in any situation can have complications. This is true. But natural birth is no more inherently dangerous than any other type of birth. In fact, the more drugs you add and the more operations you have, the more dangerous your situation becomes. And that is just a fact. Yes, there is infant and mother mortality around the world in both situations. And in the past, yes, a lot of women and a lot of babies died in childbirth. But these were due to a lot of things that today, in the 21st century, with the medical knowledge we have, are treatable and preventable for the most part. So a lot of the things that you think, oh, women are dying right and left in natural childbirth, these are things that with modern prenatal care can be identified, prevented, or treated. Or things like infection in a hospital setting, which in the 19th century and early 20th century was a huge cause of death, we have under control now. And people giving birth in third world countries may not have access to the type of sterile environments that we have today, which might be a huge reason why they might have higher infant and mother mortality rates. These are not problems that I'm worried about because I've had excellent prenatal care. I am giving birth in an excellent hospital. And I am confident that all of those things will not contribute to any sort of issue for me in my birth. I don't have any fear going into it, of any irrational fear, that is, of some crazy thing, you know, killing me or my baby. I'm not afraid, okay? That was a big rant. I'm sorry, I got a little carried away. And like I said again, do whatever you want to do. You make the best decision for you and your child, but do it informed, do your research, find out the risks of the procedures that you're going to have done or that might be done, even if you don't plan on doing them. I've researched C-sections, I've researched epidurals, even though I'm not planning on having it, because you never know what course your birth is going to take. So be informed, be smart, and do whatever is best for you in the moment. Wow, sorry, that was really ranty. I hope it didn't come off preachy. Please don't be offended if I sounded like I was trying to tell you that you were wrong about anything. I'm not really. I just wanted to make sure people were enlightened a little bit about the fact that natural birth is not inherently dangerous. It is a natural process. And so going into that, let's talk about my birth plan really quick. Okay, I want to go into labor naturally, hopefully, without any sort of induction unless I have some crazy weird medical problem that calls for it. End of story. I'd like to labor at home for a little bit before I head to the hospital. Like I've mentioned before, I live 2 hours away from my hospital. I'm not worried about this at all. I think I'm going to have plenty of time to get there even after I've started labor, depending on how my contractions go. And of course, I will play that by ear when it's happening. Next, once I get to the hospital, as long as I am able to be admitted, I am going to request intermittent monitoring so that I am not strapped to the machine all the time and I have free movement. So I can move around my room, I can move around the halls, do whatever I have to do to be comfortable and to help progress the labor and move the baby down. I am going to request low lights, music, and aromatherapy. This is just the type of environment that I feel will contribute to me being more calm, relaxed, zen, and a better environment for the baby to come out into after they're born. And luckily, because my hospital is really on the same page with me on a lot of this stuff, those are things that they basically already do anyway. And my doula, who is a part of the hospital, she's from the hospital actually, she has access to all of these things: essential oils, birthing balls, massagers, anything you can imagine that a doula might use to help you in labor, she has, and she has access to through the hospital. So yay, that's good. And so I'll be hopefully utilizing whatever I can in that arsenal to help me be calm and zen and relaxed through my labor. And I'm also going to be wearing my own clothes. I know some women really don't mind getting into the hospital gown and all of that. If I happen to end up in a hospital gown at some point for, I don't know, whatever reason, that's fine. But I just don't like going into labor and checking into the hospital and seeing the entire process as I'm a medical patient now in the hospital. There's nothing wrong with me. I'm in labor. So I want to be as comfortable as possible and I don't want to feel like a patient, you know? So I'm going to hopefully wear my own clothes. Maybe not a lot of it, depending on the situation. I might just have on a sports bra and a nice sort of like a nightgowny kind of skirt that's really loose. And that might be it, but I'm gonna sort of plan that out as I pack my hospital bag here coming up shortly. And my hospital's totally fine with that. So the more comfortable I am, I think, is the most important part. And I think that will help me feel more like myself and like a more comfortable, homey environment for me, which is good. Okay, so when I get to the hospital, obviously I will reiterate with everyone that I am not going to be having any type of pain relief or medication, no epidural, blah, end of story. In my mind, there is no option at all to the possibility of having pain relief. I am not going to have drugs. I'm not going to have an epidural. End of story. I think if you leave it open in your mind, you go in saying, well, we're going to see how I do. You're not going to do it. You're going to get the epidural. So there's no chance in my mind. End of story. But yeah, that's just my mindset at the moment going in. And so no pain relievers, but my hospital's policy is that I do have to have the stent put in my arm so that they can access it for an IV or drugs or whatever they need to do, depending on whatever situation arises. And I'm totally fine with that. I'm not going to have an IV. I'm gonna, decline to have the IV put in right away. But I am fine with having the, port there, because I totally understand from my doctor's perspective that if they need to get me hooked up to something really quick, that's going to be, they don't want to be worried about finding a vein in that moment. They need to have that access. Totally cool. So that's that. As far as when it's time to birth the baby, I want freedom of birth positions. So I want to be able to birth however I feel most comfortable, be it on all fours, squatting, on my side, however. Just in case you were wondering, birthing on your back is not the most efficient position for birth. And so even though a lot of people do this, just sort of hospitals, it's just policy that it's just normal for women to birth on their backs. If you're having any type of difficulty getting the baby out, that might be part of it. And so I would recommend looking into some of these different positions that are a little bit better as far as working with gravity, opening your pelvis up, and giving that baby lots of space to get down there. So yeah, any birthing position. And obviously you just have to see what's most comfortable and what feels right at the time. So we'll see how that goes. They do delayed cord clamping automatically at my hospital, which is great because that's what I was going to request. So I would like to, if possible, do a mother-assisted birth. I'd like to be able to help bring my baby out, get him on my chest, and they're not going to cut the cord right away, so we're just going to have a minute there before we do that. And then my hospital does an immediate hour of skin to skin, which I heard, that was like, you guys are awesome. That's so cool. I was going to request it anyway, but hey, they're working with me. So he's going to come up and they're going to do the APGAR test and maybe take a little bit of the gooey stuff off of him. But otherwise than that, he is basically untouched, and he just stays on my chest for that first hour. We are gonna try to breastfeed within that hour. My hospital actually recommends that, and so does my doctor. And yay, because that's what I was hoping to do anyway. And then after he's fed and we've had that skin to skin time and we've bonded and cried and everything's wonderful, then they'll come into the room and we'll do the weighing, the measuring, and we'll do the eye ointment, vitamin K shot, and the hepatitis B shot. Okay, my battery's dying, so I have to get through the rest of this quickly. So they are waiting to do those procedures, and then they're also waiting to get the baby a bath for at least 6 hours to remove the vernix, which is something I wanted anyway, and that is my hospital's policy. So again, we are on the same page. I forgot to mention, as far as birth goes, I don't want an episiotomy. If I tear, I tear, but I don't want them to do it for me. And no vacuums or forceps, instrumental birth. I like to try other methods, changing positions and things like that before we stick some random instruments in there and yank the baby out. So after the baby's born, absolutely no bottles, pacifiers, or formula is going to be introduced to the baby. He will be only breastfed by moi. And absolutely no one will be removing him from the room or doing any type of medical procedure on him without us present. And thankfully my hospital is totally one of those you keep the baby in your room the entire time type of places, unless you would like a break. They do have a nursery. You can request to have the baby taken to the nursery, but they will not take the baby there, and they will not take him out of the room to do any type of procedure. Everything will be done in the room with you. So that's good. I've heard a lot of people who were like, oh, they just took my baby away and did this without me even knowing, you know, something like that. And you're like, what? How is that possible? But it happens. So thankfully in our situation, I am requesting to make sure that that happens, but it shouldn't be a problem anyway. My biggest concern was, like, I was talking to my doula and I'm like, I just don't want anyone to like take him out of the room and go and like circumcise him. That would be really no bueno, because we are not circumcising. So no one takes the baby out and no one touches anything that they're not supposed to touch. So she's like, I got that written in big letters on your files, so don't worry about that. So that's good. As far as managing my pain and all of that, I told you I'd be utilizing a lot of the hospital and the doula's pain management techniques. I'm also going to be doing hypnobirthing. I know I've mentioned it in other videos, but it's just hopefully a method where I'll be able to breathe and do visualizations and hypnosis on myself to keep myself in a good place where I can mitigate the pain as much as possible and stay calm and peaceful throughout the whole process and help facilitate birth myself by mentally, you know, helping the baby move through my body and down and helping my body work the way it's supposed to work, release the hormones it's supposed to release, and work together to get the baby out safe and peacefully. And so this is my ideal birth, and that was my birth plan. And I'm sorry if I yelled in the beginning or sounded a little too intense for you. I didn't mean that. It kind of got out of hand. So anyway, I would love to hear about you guys, your philosophies on birth, or what you're doing or what you did. Any tips you have for me knowing the type of birth that I would like. But not like judgy tips like, you will be able to last 2 hours without pain medication. None of that. But otherwise, I would love to hear from you, and thank you so much for watching. I'm gonna get out of here because this video is probably super long. And so we'll catch up with you guys on my 34-week bump date, which is coming up very soon. Hi guys, it's Jenny. Welcome to weeks 32 and 33 of my pregnancy. I'm doing another 2-for-1 this week because I ended up unexpectedly going out of town last week during my 32 weeks, and I was just so busy and everything was just kind of crazy for a couple days that before I knew it, I was in my 33rd week already, and I hadn't had a chance to record the vlog, and I just got home. I think I was like 33 weeks, 2 days when I got home.